Walden, Colorado is located in frontier Jackson County. A frontier county is a federal designation for a county with 6 or fewer residents per square mile. The isolated high mountain park is home to a diverse economy featuring ranching, oil and gas, city and county government, logging, tourism, and recreation. North Park Medical Center, the only medical facility in Walden, serves the core population of approximately 600 residents year-round, as well as hundreds of additional visitors each year. The closest hospitals are at least 60 miles away through mountain passes in Steamboat Springs and Laramie, Wyoming.
I get asked the question a lot of what type of people live in Jackson County or in Walden. I said the type of people that still want a cabin outside of Walden.
You know, there's a lot of really sick patients here because they do not seek health care, because they do live on their own and they just, tough it out for years and years, and then they show up at our clinic and they've had a heart attack and they have, a list of 10 health problems that they've never dealt with.
Lots of small business, a lot of very independent, tough people up here. You have to be, right now is the most beautiful time of the year, but you have to be tough to live up here when, you hear about couple years ago we were closed down for, I think it was 3 full days. The only road we had out was Laramie, and you just make it work.
Jackson County, as of August 10th, 2021, has recorded 69 cases of COVID-19 with no deaths. The first documented case in Jackson County was not until June 2020. Community response to the pandemic has varied widely.
Some of it, this isn't real, this is a hoax, this is, and which I think is everywhere. And some of it, people were taking very seriously. People are scared, especially, and they felt safe here. A lot of people felt really safe here because we're so isolated and it's so small, and, people felt safe here. So, like I said, it was kind of a 50-50. It was a mixed bag of emotions, I think, and how people handled things. Some people flat told me, where to jump when I called to say, I'm sorry you've been exposed,
Population density is about 0.8 people per square mile. Social distancing is our lifestyle. So you can come on up and typically there's room.
Being isolated here has actually been good. I think it does lull people into a false sense of security as far as the precautions taken. Like, we're isolated. We don't have the cases up here. Why do we need to wear the masks?
Dr. Lynette Telk was born and raised on a ranch outside Walden and returned to the community after medical school to serve as the clinic director and director of public health. In both roles, she serves as a trusted leader for the county's COVID response efforts.
So trying to take care of patients with COVID has been very difficult. We have very polarized views on COVID. I've never seen a medical situation where I had to try to stop all these other perceptions and just go back to the basics and say, okay, forget all that. Let's look at your situation, what the science shows, and try to take care of that patient based on that.
At the start of 2020, the town of Walden did not have a public health nurse. In November, at the heart of the pandemic, the town was able to hire Marcy Clendenin, a registered nurse who grew up in the community.
The good and bad side of COVID is there's been a lot of funding geared towards public health, which has jump-started our program, and we found a great person to come take that on, and Lynette Telk, our local doctor, is our public health director, so that's great.
So when I got here, we're in the middle of COVID and a middle of a huge exposure at the local bar here, and so we had to, it was hit the ground running, calling people, hey, I gotta quarantine you. And they're like, who are you again? Hi, it's me. Remember me? I was here, I grew up here, I graduated here. I was like, well, if I'm not hated now, you know what I mean? Like, it was kind of a running joke. And so, yeah, like I said, hit the ground running.
Our public health department and the Board of Commissioners, which is also the Board of Public Health, worked hand in hand, very much transparent on what we wanted to do. We discussed a lot of things once the program got started, and that was a success story for us of 2020, which there wasn't a lot to hang your hat on in 2020 because most everything shut down. You couldn't do a lot of stuff, but we're pretty proud of that program and we want to make sure it keeps going. So that was the bright spot for sure.
one of the reasons I took this job, because I was so excited to, what can I bring to the community? What can I do to build this community and the health services? And I had all these ideas, and so I'm really excited now that COVID is quieting down. It's still very much a part of the picture, but we at least have time to breathe and say, okay, what's our next steps? And I'm so excited about that.
The clinic staff, with the support of local public health, is working hard to increase vaccination numbers in the county. Opinions around town are diverse and varied about getting vaccinated. As of 8/17/21, 44% of Jackson County has received at least one dose of a COVID-19 vaccine. The state average on the same date was 61% for at least one dose. Jackson County has the 13th lowest county rate in the state, meaning 51 out of 64 counties have higher rates.
This community is very conservative, I guess I would say. And so a lot of times they're not receptive to some of those things, but absolutely, we've talked to a lot of our patients, Dr. Telk and Marcy, obviously, being public health, they've talked to patients and people out in the community about how we can protect our community members and doing our part. I still think it's a personal choice, and if you choose to not get that and you feel like that's not what's best for you or for your family members, I still feel that I'm not one to push that on people.
I mean, there is a lot of vaccine hesitancy there, and changing people's minds has been a struggle. One of the best things that I think is when they have a loved one or even a friend who got pretty sick from it, and it's like, oh, okay, now it's my turn. I've had several people, I wasn't gonna get it, but then my friend down in Denver spent 50 days in the ICU intubated, and I feel like I need to get it. Those were the people that I wasn't gonna change their mind until something really truly impacted them personally, and that's kind of where I feel like we're at now. Unless something impacts somebody personally, the people who have wanted it, they're gonna get it.
There have been people that have questioned it, and just asked our opinion. They've asked me if I've been vaccinated. I did. I was, when early stages when they was first rolling out. But I had my opinion or my reasons for doing it. And talking with people, you'll ask them, have you been vaccinated? This was when we were first rolling it out here, and Marcy was just starting to get things. Some people were still on the fence about it. They weren't sure because of the quick turnaround, how quick it got out. And so it was hard for us to speak to, yes, this is going to be great and you should do this. Everybody has their opinions.
I think Dr. Telk has really helped because she's from here too. I think that's, and she's pretty consistent with her messaging, and just us being consistent and saying the same thing of, yes, this is safe. And, I think that's helped out a lot too, because, we are trusted members of the community. I just left and came back.
As the pandemic continued, community leaders were quick to identify the mental health toll that the pandemic was taking on the population. Mind Springs Health is a mental health service provider serving 10 counties across northwest Colorado. They treat a large scope of behavioral health care needs, including prevention services, outpatient services, and in-community services like school-based mental health initiatives. North Park Medical Center offers outpatient mental health services from Mind Springs 3 days a week, but Mind Springs is limited in what insurance they accept.
It definitely displayed we had a need for a public health department, but we need to figure out how to get a mental health presence in Jackson County. And we had a counselor who lived here for a long time. She was great. She passed recently, and we didn't realize there was a void there until some of this started to happen.
Seeing these patients just fearful truly affected their overall health, not even related to COVID. Their mental health, their physical health. People are so isolated and so terrified.
The mental health is my biggest worry, and I think that's truly going to be our biggest pandemic, more than COVID, is the depression, the anxiety. I saw a guy in February that it was the first time I'd seen him in a year, and he's like, "Doc, I haven't been out of the house since March." And I'm just like, the mental health it's always an issue for rural health, but I think coming out of COVID, we're going to see mental health issues for 5-10 years at least.
Funding for home health care and community paramedicine have emerged as top priorities. Funding is needed in order to provide essential access to these services. According to RHI Hub, community paramedicine is a relatively new and evolving healthcare model. It allows paramedics and emergency medical technicians to operate in expanded roles by assisting with public health and primary health care and preventative services to underserved populations in the community. The goals are to improve access to care and to avoid duplicating existing services. Walden is hopeful that federal stimulus funding can help with these and other initiatives as the region looks to rebound from the pandemic.
So if the clinic wasn't here, and the clinic is an 8 to 5, we don't have after hours, we don't have weekend hours, we're 8 to 5 Monday through Friday. Our backup, and truly the safety net of our community is EMS.
If you're in a serious accident up here, more than likely you're gonna get flown to Medical Center of the Rockies or Steamboat Fort Collins because they want to save your life. So our EMS services up here are exceptional. They're usually volunteers and they do an amazing job.
I think that the community, the older population here, all kind of stay together and help try to support each other. But as far as healthcare, we don't have the resources they need, such as an assisted living, a pharmacy. Home healthcare is huge. Hospice, those things for them to stay at home. We just don't have, and it makes it really hard for them to be here. So, going back to home health services, that is huge for our community. Even if it's the community paramedicine where they're able to help us out and actually get funding for that, that would benefit our community for a long time on multiple levels.
A lot of people want to stay here and live here until they die, and there's nowhere for them to go.
And we don't have hospice.
Yeah, no hospice.
We have a few CNAs who do some home health and can help patients out, but there's no community paramedicine yet. We're working on that, but there's nobody out there who is full-time that's able to do that.
The community paramedicine is an amazing service that we could provide for our community and be able to probably sustain some sort of a home health care. It's not the same, but absolutely, if there's more funding for that, that would greatly benefit our community and our EMS service as well.